Good afternoon. I'm Bobby Webster. I'm the Public Relations Director for the Oneida Nation, and we're here Monday, April 20th on the Oneida Nation Reservation. I just want to say that it appears that everybody's doing a pretty good job of staying safer at home. Our statistics have been somewhat flatlined. It's not good news all over the place, but it does mean that on the Oneida Nation Reservation we're kind of taking care of ourselves. And we will have a health update from Debbie Danforth from the Oneida Clinic. We also have Keith Dockstader, who's with our Trust and Enrollments Department, and also Secretary Lisa Summers with the Oneida Business Committee. So we're ready to hear something about social distancing, its impact, and what's happening, Debbie.
Good morning, Bobby. Thank you. I'd just like to start out by just kind of giving you a snapshot in terms of some of the data that was shared with the community on April 3rd when Dr. Veer gave one of our first Facebook Live updates. So we started out with COVID-19 cases on April 3rd globally, over about 1 million positive cases and about 55,000 deaths on April 3rd. As of this morning, globally, there are about 2.4 million positive cases and nearly 166,000 deaths. Within the United States, on April 3rd, there was about 245 cases and about 6,000 deaths. As of this morning, there's nearly 761,000 cases and over 35,000 deaths in the United States. For the Indian Health Service specifically, on April 3rd, there was about 268 positives, with most of them being in the Navajo Nation and the Pacific Southwest. As of 4/17, there are over 1,596 positive cases within the Indian Health Service overall, and about 908 of those cases are specifically in the Navajo area. Within the Bemidji area, which is Minnesota, Wisconsin, and Michigan, there are 17 positive cases. And of those 17 positive cases for Oneida, we have 2 cases in Brown County and 3 cases in Outagamie County within the Oneida Reservation, and no new cases to report of as of today. For Brown County alone, the state of Wisconsin overall has 4,346 positives, with 220 deaths. And for Brown County, it was a pretty busy weekend. Brown County has 215 positives to report, with over 70 of those positives being over the weekend and 1 death. Outagamie County is staying pretty much the same, with 35 positives and 2 deaths. So I just wanted to provide just a real quick snapshot in terms of what some of the issues are that we're still facing. Testing continues to be a challenge. It pretty much remains the same in our area. We're struggling just like the hospitals are in our areas, and the health division meets with the hospital systems on a daily basis to talk about testing and some of the issues that the hospital systems as well as the public health areas are running into. And testing continues to be completed right now in tiers, although the recommendation from the state of Wisconsin is to continue to enhance the testing that we can, but supplies and access to supplies continue to be an issue. I was asked to define what peaking means and how do we know when we're at that point. What peaking simply means is that the number of positive cases have reached a point where they're no longer increasing dramatically. And as we've seen in other states like New York, which has been hit especially hard, they're starting to see a decrease in the number of positive cases and a decrease in the number of severe hospitalizations. So we say they're peaking at this point, or they're leveling their curve. It doesn't mean that when we get to that point we can stop the measures that we're currently doing. We need to continue to be very diligent about continuing to follow the measures to slow the prevention and to slow the spread in terms of the disease itself. One of the other questions I was asked to address was, what will the new norm be for clinics and clinics in the area? And if any of you have been watching television, you've seen a lot of the commercials in terms of telehealth. I think that's going to be the new norm that you're going to see for a lot of healthcare facilities. Telehealth, telemedicine, using a lot of the various forms like Skype, Zoom. A lot of the clinics are using those formats, and we as the Oneida Comprehensive Health Division are also using that format to be able to provide services to our community and to our community members. So we've been doing kind of, about the last year, we've been doing telepsychiatry, specifically at Oneida Behavioral Health, where we've had our psychiatrists using Skype and Zoom to be able to do psychiatric services over that system. And they have enhanced the ability to do a lot of their behavioral health services, such as their groups and their individual counseling services, and they've been using Skype and a lot of the other techniques. Our physical providers, as far as our clinic, has also been using that format as well as telephone to be able to get in contact with their patients and provide the services that they need. One of the other questions that I was asked to address has been, are we considering developing some type of a COVID-19 training for recovery? The Health Division has been working on developing a plan for what we see as the new norm as we move forward. And what that basically means is, how are we going to continue to provide services? Will we continue to provide services using telehealth, using Skype, using the telephone as a means of getting in contact with our patients? Another point that we're looking at is, how do we open up business once we get the okay to do that? And that may include meaning that we're going to open in stages, that we're going to be able to address the concerns of the patients coming in. And our biggest concern is that we want to make sure that things are safe, not only for the community and our patients, but our providers and our staff as well. We've continued to work with the casino at this point to look at what those measures would be and what we would need to implement to continue to assure the safety of our customers and our employees in all of those areas as we begin to think about opening doors again. But the biggest thing I think I want to mention is that it's not the time to flip that switch right now. We can't go back to life as it was before this pandemic started. We need to continue to be cautious, and we need to continue to practice the critical prevention measures that we're all doing. And that means safe distancing, making sure that we're wearing masks when we're going out, limiting our visits to get groceries or to get medications or to do any of those things, making sure that we're masking, making sure that we're following all of the guidance in terms of hand washing and safe distancing in all of those areas. Because the biggest thing we want to see is that we continue to see a downward curve in terms of the number of positive cases. We don't want to open too soon so that we might see a spike again in the number of positive cases across the country and within our community. Thank you.
Keith?
Hi everyone, I'm here to provide 3 updates. One on our trust functions, a second on enrollment items, and a third a little bit more on the broader economy and recovery time. So jumping first right into trust, I'm happy to announce that the trust still has the money available to continue paying its bills. One of the questions we get is where'd that come from? And the short answer is Oneida's been systematically saving money, setting it aside into trust for over 35 years now. So that's been protected, set aside, invested, and continuing to grow for us. What we do with that money, the Elder Per Cap Higher Education and General Welfare Trust, is we pull out about $4.5 million each year. The biggest 2 things we spend that money for is the OLIP, Oneida Life Insurance Plan Plus premiums. That's the life insurance policy that provides each Oneida member $15,000 for a death benefit. Those premiums are still being paid out of the trust, and each member still has that $15,000 death benefit available to them. Second, trust pays for a portion of the per capita, specifically the elders age 65 and over receive a little over $700 out of trust. That money, the source of those monies have always been the Elder Trust Fund, not the tribal contribution. So we received some questions about per cap being discontinued for this year, but the portion that came out of trust, not the tribal budget, is still on. So again, that's only for elders age 65 and above, and the payment will be a little over $700. I hope the membership feels proud of the past savings and that we can continue to pay these bills out that provide valuable membership to, or that provide a valuable benefit to our membership. Unfortunately, the trust is at its sustainable spending cap, so there's no extra money or funds available to consider adding a new benefit at this time. The other big area we're receiving questions lately is the miners trust funds. Specifically, they will still be distributed this year to everyone old enough and that met all the requirements. So we'll be following the normal schedule as best we can. The follow-up question is usually, what happened to the accounts? Are they down due to all the investments? And the short answer is yes. With all the investments going down, the miners trust accounts are certainly no exception to that. I can share though that those ages 15 and above, the Trust Enrollment Committee has been preparing for distributions to occur for up to 3+ years now, and they have those invested in a very safe, conservative manner. Year to date, those age 15 and older accounts are only down 0.3%, or said differently, go back and look at your end of the year statement, and for each $1,000 that your account is worth, you can expect about a $3 loss. That's the numbers as of today. They're clearly going to change this week and over the coming months before your distribution, but hopefully that gives you a ballpark of what to expect your account to be worth. Moving on to enrollment items, our office is closed right now to help protect and keep our staff safe, so we cannot do any of those in-person items, specifically preparing tribal IDs or doing DNA testing services. We cannot offer at this time, but most of the services we provide can be done by phone, by email. Our website is available and most of our forms are available on there, so feel free to hop on there, give us a call, shoot us an email. We're still happy to help out any way we can. Got a question about Sustain Oneida. I hope this pandemic only serves as a reminder that this is still an urgent conversation. We haven't seen a huge death toll like the Navajo or like other states, but I hope this is still an issue that's on the forefront of everyone's mind and we can continue these conversations. Finally, moving on to a little bit about the economy and the recovery process. Some of the financial experts are likening today's environment to the big 2008 housing and liquidity bubble we saw burst. This drop hasn't been quite as big, but it's been much faster. To be optimistic, so has the response to it. The federal response has been much faster and much larger than what we saw in 2008. And I hope that serves to help mitigate damages. And I'm hopeful that the federal decision makers we have continue that direction to mitigate the downturn in losses. I think the consensus among the financial markets is that 2020 will continue to be a down year, loss of revenues, loss of earnings for pretty much most companies. And we're hopeful that 2021 can begin a recovery process. What does that mean for Oneida? In my opinion, I am expecting us to be on the later end of the recovery cycle. Gaming being our largest driver is on the tail end of the recovery period, as that's more of a discretionary spending, not a need for some customers. And we're going to have to go through a few steps to see that picking up. After the public is open to move about again, I think then we'll see businesses starting to reopen, rehiring some of their employees that were laid off. And then individuals need to go through that recovery process to get some money back into their pocketbooks. They need to take care of their immediate expenses first. And I think human behavior is to save money during times of uncertainty so that they have more flexibility to prepare for what's coming up next. Once individuals begin to recover, then I think Oneida is going to have its own recovery period where we need to take care of our need to expenses first. We need to shore up our financial foundation, and then we'll begin a prioritized what do we want to spend money on period next. Thanks.
Thank you. And now we'll hear from Lisa Summers, Tribal Secretary.
Okay. Thank you very much, Bobby, and thank you, Debbie and Keith. There's a few things that I'd like to cover for everybody that the business committee continues to get questions on. Obviously, the recovery that Keith just touched on is one of the bigger items that we continue to get questions, most recently in the last week or so, especially since the governor's new orders about some limited openings to businesses has been put into place. And so people are kind of just wondering generally, what does that really mean for Oneida at this point? And so one of the things that it's important to remind ourselves of is that Oneida does have a sovereign status that we continue to exercise through our own public health orders and through our own safer at home orders. And currently Oneida's order emergency extends through May 12th. So that continues to be the target date that we're going to look at. And then as far as reopening any businesses, I think that Keith has done a really good job and Debbie have done a really good job of explaining all of those factors that we're taking into consideration as we determine what the recovery period looks like for Oneida. So at this time, one of the things that we are starting to do is really looking at the planning phase of that and identifying those key things that we need to take into consideration. Public health continues to be and will continue to be the foremost thing that we consider as we talk about recovery. And then the next is going to be the financial condition of the tribe. Because one of the things that was just mentioned was about the Sustain Oneida. That continues to be at the forefront of our minds when we make these decisions. And for us, really looking at protecting our population of people. We know that we only have roughly over 17,300 members, and a good majority of those individuals live on the reservation or in Brown or Outagamie County. And we also know that a good portion of the population for Oneida are elders. And we also know that we continue to experience higher rates of health issues such as diabetes and other underlying health conditions that people can be affected by severely if they were to contract this disease. So these are all the types of things that we take into consideration as we look forward to the future and what that could potentially mean for us from an opening perspective. And I can't give you a more definitive answer than that at this point, other than that we are starting to look at recovery, we are taking it very seriously, and we are looking at our experts' opinions, and we're relying on them to provide us the information that we need to do everything that we need to do to reopen businesses in a safe way. So please continue to keep that in mind, and we will continue to answer any questions that you have to the best of our ability. So a few examples of those, for example, the election. That has been asked several times over this last week. Well, what are we going to do about the primary? What does this mean for the July election? And we know that certain things are in place that we need to consider. For example, the Constitution states that a person must present themselves at the place of the polls when they cast their vote. And so the answer at this time is we are closely monitoring the recommendations that are coming forward from the election board on what potentially voting could look like this year. We know that other states around the country do things such as they force mail absentee ballots to everybody, and then those individuals are able to do basically drive-up balloting. And so when you look to other states in the country and those examples that are provided, we feel that there's some possibility there to look at those kinds of models to be able to say we could mail ballots to people, and then those individuals would possibly dropping those things off in their vehicles. And so, I encourage people to do those researches, look those things up, and then also if you have ideas or suggestions on how we could implement some of those efforts, please by all means continue to contact the election board. They're your elected officials, as is the Oneida Business Committee. We are looking at all possibilities. So that would be for one part of the election. The other part of it would be possibly is we don't know the answer at this time. And I want to make sure that we continue to answer the questions as truthfully and as honestly as possible. And it is a very real thing that we may not be able to hold an in-person election. And if that is the situation and it comes to that, the election board will advise us of that. And again, all of our areas are working collectively with our health experts in order to make sure that we conduct any business that we need to conduct according to the Constitution or other laws and rules of the tribe in the safest possible manner. So those are just a couple things I wanted to touch on regarding that. The same holds true for General Tribal Council. We have been getting a few questions about what about the General Tribal Council meeting in July. Many of you are aware that the Business Committee already has taken action to suspend the stipend requirements for the remaining of this fiscal year and then for next fiscal year as well. So some of the things that we are looking at is how do we hold a General Tribal Council meeting as safely as possible. There have been suggestions brought forward about potentially doing a virtual meeting. So we have taken that suggestion seriously and we are looking into the possibility. There are challenges to that. As we all know, General Tribal Council meetings are generally considered closed meetings. And so that would be one of the factors that we would take into consideration as we look at all the possibilities of holding a General Tribal Council meeting in the future. Please continue to monitor the tribe's email, the tribe's website, the COVID website as well. We will continue to publish information as it becomes available on all of these subject matters. So again, the election board will continue to provide information as needed on the general election, and then the tribe's website will also continue to provide information on things like the General Tribal Council meetings as needed, and as those things draw closer and we're able to make determinations about how to best proceed. And then the last thing that I just wanted to touch on real quickly is the committee does continue to get questions about whether or not the business committee took any kind of a salary cut or if we reduced our hours and things of that nature to help out during this crisis. And the answer is yes. Every business committee member did on a voluntary basis take the opportunity to contribute to reducing the amount of expenses that the tribe experiences on a weekly basis. And so the answer to that is yes. The business committee did implement, again on a voluntary basis, a salary cut. So again, thank you very much for your attention, and I believe I will turn this back over to our moderator, Bobby Webster.
All right, thank you everybody. Great information, and of course we do have questions, and as we always do, we're going to try to answer those questions in real time. And as usual, if we don't get to your question, please go to our webpage, and at the very top of the Oneida website you'll see the orange banner that says COVID. You can click on that and that takes you down to most of the information. So the first question I have is for Debbie. Should we trust the testing site at the Sears store? And there's some tents set up there and apparently a testing site.
Yep.
Do you have any insight on that?
Yeah, the testing site is actually where a lot of the calls coming into Purveya or any of the HSHS sites, they are referring individuals there. You can't just drive up, you have to get a referral from your primary care provider in order to go there for the testing, to be tested for that. So
Okay.
yes, it is a trustworthy site.
Thank you. Another question is, will we be requiring testing as we open up and discontinue the telenetworking? I'm not sure if you can answer that question.
Well, the whole thing in terms of testing, the governor is going to be having a conference call this afternoon that he is going to be talking about how they're going to ramp up testing and the potential that some of these tiers that are currently in existence may decrease. But at this time, the difficulty that we have as far as testing, as well as the hospital systems are having, is getting the supplies and being able to have access to those supplies. So to require the testing is going to be extremely difficult at this point because we don't have the adequate resources to be able to do that.
Okay. Also another question is, can we post on GTC and Friends page? And the answer is we don't post on any other page except the Oneida's Nation website. This is the official communicator and official page of the Oneida Nation. People may link our information. It's easy to paste in a link to others to join, but we don't post on others. That way we're able to protect the confidentiality and the proprietary and the integrity of our programming and our website. Another question, when will dental be open for more work?
Again, dental right now is currently just saying emergency services, and that will continue until some of the restrictions have been lifted in terms of the safer at home requirements for the state as well as for locally.
Okay, good. All right, now if I missed your question, I'm sorry, because I'm trying to monitor this and some of your questions just flip out of sight before I can get to them. But this one is for Keith. My child is 15. Are the investments for the minor trust in a conservative account?
Yeah, so I'll answer a little more generally. We split up all the investments based on their age. If someone's in the ages 0 to 14, they're invested one way, and if they're 15 or older, they're invested a second way. Really high level, the 0 to 14 account is about a moderate risk investment right now, 60% stock, 40% bonds. The 15 and older account is in a much more conservative, only about 15% in stocks, the other 85% in bonds. Those mixes have led both of them to be much safer, much less volatile than the overall stock markets you may see on the news. Year to date right now, the 0 to 14 account is down about 8 or 9%. Year to date right now for the ages 15 and older account, it's down less than 1%. And that's done to prepare the 15 and olders for receiving their money. We want to avoid a big loss right before. Those in the 0 to 14 bucket, we're, I'll say, a little less concerned about seeing the drop now because we know we have at least 3, if not several years to participate in a recovery period.
Okay, another question, I wasn't sure, I didn't get it written down, but I seen some reference to the minor trust accounts. And I'm not sure if this was it, so I apologize if I'm misrepresenting the question, but the schools going out of session, not sure how seniors may be impacted by getting their diplomas and what impact that may have if they finish the school year and those who are 18 getting their minor trust payments.
One of the requirements for an 18-year-old to receive their minor trust distribution is to provide proof that they finished high school. We had the conversation about our timeline and if that's going to need amending, and the short answer is, I don't know. As we proceed into the summer, if the schools are getting diplomas out in a relatively similar time period, we'll probably keep our process the same. If schools are being delayed a month or 2 or 3 to get their diplomas out, then I think it's only fair that ONIDA and our committee reviews its process to allow those 18-year-olds who did graduate time to fulfill that requirement.
All right, thank you. Another question, and I'm sorry if you covered this, I was writing things down, so you may have covered this, but I have a question about the 401k. Do we know if the 401k is impacted by the COVID as an emergency? Are there any provisions for early withdrawal?
I'm not sure on our specific 401k plan. Speaking in general terms, a lot of 401ks and qualified work plans do offer emergency hardship distributions that would waive the penalties of taking it out of your account. However, note that it does not waive any of the tax implications of taking your money out. Plans differ from across different companies, and I cannot say for certain what the ONIDA specific plans are.
I can add to that a little bit. So just so that employees are aware, if they have a question about their 401k, and my understanding is, are they able to utilize their 401k as an emergency distribution? The business committee did authorize that activity to take place with the employees' 401ks, and that resolution can be found on the tribe's website.
Okay, thank you, Lisa. We also are getting questions about higher education, and I'm not sure if anybody can answer. It's sort of a broad question, and we don't quite know how to answer some of the questions. They're very more individualized, but Lisa, can you give us a general question on what higher education is doing in terms of funding?
Sure. So one of the things that the business committee did need to do in our current financial situation is reduce the higher education scholarship from an annual award of $20,000 to an annual award of $5,000 per student. So for specific details about how that award is going to be implemented, you do need to still contact your higher education person over at that department. However, that was an adjustment overall that did need to be made to the program.
Okay, thank you. I have one more question, and Lisa, I guess this is something, it's a gaming question.
Mm-hmm.
I don't know if we have the answer, but are we looking at putting slots back into the one-stops as we begin to social distance and look at putting greater distance and somehow having to dispel these machines all over, distribute these machines all over? Are we looking at perhaps putting them back in?
Sure. So I will take a stab at answering it. So many of you who are familiar with our gaming operation, there are currently 2 locations that do have slot machines at their locations. The first one is the Highway 2932 location. That is considered an outlet store or an outlet facility, and then also at the Packerland location. Any other additions to that would be done through the gaming recovery plan, and unfortunately at this time I do not have that specific answer, but I know and I'm confident that gaming is looking at all of the options available to them in order to implement the best recovery plan possible for the operations.
All right, thank you for answering the questions to the best of our abilities. If we don't know, sometimes we just don't have the answers. This is a pandemic that we've never been through before. It's unprecedented, so we're really scrambling some days to get the answers and to address the questions, but we still continue to strive for bringing everybody together and coming back in a safer, more cleaner, more healthy nation. So we want to thank you for your concerns, your questions, and especially your patience. So we continue to encourage everybody to support one another, be there for one another. Remember, you are safer at home, and we're very happy that the Oneida have been flat. We're maintaining ourselves, so let's stay that way. Thank you.